Hey everyone, I'm Surgeon Brandon, and I was asked to share one of those bizarre experiences that I've had in surgery and in medicine. And I think, frankly, many of y'all won't believe it. It's not to make fun of anyone or challenge an individual's decision making. No, I'd rather want to share this in order for us all to learn something from the story, as well as prevent patient harm in the future. And there's a lot of key points that I'll talk more about in later videos. But before we get started, I'll also say that I had to modify some of the specific facts just to protect the individuals involved. But this is based on a true story, and you probably won't believe it. So years ago, a patient of mine came to the emergency department. She was a young woman in her 20s, 30s, 40s, let's say, and she had several day history of terrible knee pain that's progressively getting worse to the point she couldn't walk. So we went there, saw the patient promptly, did a physical history and physical examination, had concern for a septic knee joint or septic arthritis. This is a problem that occurs when you have an infection inside your knee joint, and antibiotics alone will not cure or will not get rid of this. This needs operative intervention because the antibiotics do not penetrate the joint capsule appropriately. And if left untreated, infection inside the knee joint can break down your cartilage and even break down your bone and lead to early arthritis. This is especially concerning in someone that's young, relatively healthy, with lots of years left and lots of miles to put on those knees still. And even left untreated, even more so, the infection can spread to other parts of their body, their cardiovascular system, their brain. It can lead to bacteremia, septic emboli going throughout their body. And this could even lead to loss of life. So this is important to identify and get appropriate treatment. So we even pulled fluid off the knee to make sure we had the right diagnosis, and it was growing bacteria inside the knee joint. So essentially, these bacteria are living there, and they're gobbling away the cartilage. They're having a good time, jumping off of trampolines, jumping off of diving boards. I mean, it's like a frat party on steroids. It's wild in there, and I'm emphasizing that because it's a bad infection that's in the knee joint. So we said, you're next in the lineup for surgery. We have a case that's already scheduled to go, and we're going to do yours following this one. So please, nothing to eat or drink. This is the plan for surgery. She gave informed consent. That was the plan. So while we're scrubbed into this case, we get a page from our nurse saying, hey, your patient can't get surgery. And we were baffled. We said, how can she not get surgery? We just had an extensive conversation about bacteria in the knee and how it could potentially kill her or even damage her knee joint if not appropriately treated. And the nurse said her family brought her Chick-fil-A. That must be some good chicken.